Welcome. My name is Shonda Jones, and I'm an instructor here at UMA in the MBC program. Today, we will be discussing word part structure for diagnostic procedures. Let's get started. Medical word structure for diagnostic procedures, nuclear medicine, and pharmacology. Diagnostic procedures, basic examination procedures. These are procedures performed during the assessment of a patient's condition. You also have observation. Observation observes the overall appearance of the patient, the emotional effect, and ambulation. Also, it observes the overall appearance, whether they are appropriately dressed, hygiene, possible difficulties with self-care. They look at the emotional effect, dealing with facial expression, tone of voice, mood, emotions. Also, ambulation, that's the gait, unsteadiness, difficulty in walking. Next, we have vital signs. There are 4 key indications that the body systems are functioning. That is the temperature, the pulse, respiration, and blood pressure. Temperature. The average normal temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius. Temperatures of 100 degrees Fahrenheit or higher is considered a fever. Based on the locations of the temperature readings, they are named based on their location. So if it's done through the mouth, that's oral, oral, and axillary, and then rectal. Oral is ear. Other terms concerning temperature: hyperthermia, that's an extremely high fever. Hypothermia is abnormally low body temperature. And you see here that therm means heat. Also, the pulse. This is the rhythmic pressure against the walls of the artery, caused by the beating of the heart. It's recorded as beats per minute, and the normal rate varies by age group. Continuing on with diagnostic procedures, you see here in this diagram the different body parts and what they are referred to. You see the temple, the carotid, brachial, radial, femoral, popliteal, and dorsal pedis. Next, let's look at respiration. A number of complete breaths per minute is respiration. 1 inhalation and 1 exhalation equals 1 respiration. The normal rate for adult range is from 12 to 20 respirations per minute. Now let's look at blood pressure. Blood pressure is the force of blood against the arterial walls. It's measured by a sphygmomanometer. It's recorded as a ratio. That's the systolic reading, which is the first beat heard, over the diastolic reading, which is the last beat heard. In this picture, you see a reading of a blood pressure. Again, the systolic BP, that's the first beat heard, and the diastolic BP is the last beat heard. Now let's take a look at pain. Pain may be considered as the 5th vital sign. It's subjective symptom reported by the patient. Pain rating scales describe the level of pain from 0, no pain, to 10, severe pain. For child, they use drawings of facial expressions. Next, let's look at auscultation. This is listening for sounds within the body. Usually requires a stethoscope. Auscultate means listen. And as you can see on the diagram here, they're listening for abdominal sounds. Respiratory sounds are next. Rales are abnormal lung sounds during inspiration. Rhonchi, this is rattling sounds related to secretions. Stridor is the high-pitched sound due to throat blockage. Respiratory sounds provide information about the condition of lungs and pleura. You also have heart sounds. Lub sound is heard first, caused by the closing of the tricuspid and mitral valves. Dup sound. This is shorter and higher pitch, caused by the closing of semiluminal valves. Brute is an abnormal sound or murmur heard during auscultation of an artery. A heart murmur is often due to a defective heart valve. Next, we have abdominal sounds. Normal noises of the intestine. Auscultation evaluates and detects abnormalities, and the absence of sounds can indicate an ileus. Palpation and percussion. Palpation is the use of the hands to feel texture, size, consistency, and location of certain body parts. Percussion is determining the density of body part by the sound produced when tapping a surface with fingers. And you see this illustrated in the diagram. And in this diagram as well. Now let's take a look at basic examination instruments. An ophthalmoscope is used to examine the interior of the eye. An otoscope is used to examine the external ear canal and the tympanic membrane. You see here an illustration. Next, we have the speculum. This is used to enlarge opening of any canal or cavity to facilitate inspection of its interior. And then we have the stethoscope, used to listen to sounds within the body. Next, let's look at examination positions. Recumbent is any position in which a patient lies down. Horizontal recumbent position is supine, lying on the back facing up. Dorsal recumbent position is lying on the back face up with knees bent. Lithotomy is lying on the back face up, feet, legs in stirrups. Prone position is lying on the abdomen face down. Sims position is lying on the left side, knee and thigh drawn up, left arm placed along the back. Knee chest position is lying face down, hips bent, knees and chest resting on the table. Next, let's look at laboratory tests. Blood test. These profile the patient. The test frequently performed as a group. Obtain specimens. A phlebotomist is a medical professional trained to draw blood for various laboratory test procedures. Phlebotomy is the puncture of a vein for the purpose of drawing blood. An arterial stick is puncture of an artery. A capillary puncture uses only a small amount of blood specimen. Complete blood count. A complete blood cell count, also known as a CBC, is a series of tests performed as a group to evaluate several blood conditions. Erythrocyte sedimentation rate, also ER, is based on the speed with which RBCs, red blood cells, separate from plasma and fall to the bottom of the specialized tube. Hematocrit describes the percentage by volume of red blood cells in a blood sample. Platelet count is the number of platelets in a specified amount of blood. Red blood cell count determines the number of erythrocytes in the blood. A total hemoglobin test indicates hemoglobin concentration. White blood cell count determines the number of leukocytes in blood. White blood cell differential count determines the percentage of each of the 5 types of leukocytes present in the blood. Additional blood tests. A basic metabolic panel is a group of 8 specific blood tests providing information about kidneys, electrolyte balance, blood sugar, and calcium levels. Blood urea nitrogen measures the amount of nitrogen in blood due to the waste product urea. Cross-match test determines the compatibility of blood donor and recipient before blood transfusion. C-reactive protein identifies high levels of inflammation within the body. Lipid profile measures total cholesterol, HDL, LDL, and triglycerides. Proton time, or PT, measures the coagulation test to diagnose conditions associated with abnormal clotting. Serum bilirubin test measures the ability of the liver to take up, process, and secrete bilirubin into the bowel. Thyroid stimulating hormone assay, or TSH assay, measures circulating blood levels of TSH. Arterial blood gas analysis measures pH, oxygen, and carbon dioxide levels in arterial blood. Urinalysis. This is the examination of physical and chemical properties of urine. A routine urinalysis uses a chemically impregnated stick to screen for urinary and systemic disorders. Microscopic examination provides more detailed testing. Continuing on with the urinalysis, the pH of the urine measures the degree of acidity and alkalinity. It also looks at a normal pH range, which is 4.5 to 8.0. Our urinalysis may also look at specific gravity, which reflects the amount of waste, minerals, and solids. Conditions and drug use identified through a urinalysis. Albuminuria is the presence of protein albumin in urine. Bacteriuria is the presence of bacteria in the urine. Calciuria is the presence of calcium in urine. Creaturia is the increased presence of creatinine in urine. Drug screening urine test identifies the presence of one or more drugs. Glycosuria is the presence of glucose in the urine, and hematuria is the presence of blood in urine. Ketonuria is the presence of ketone in urine. Pyuria, this is the presence of pus in urine. Urine culture and sensitivity tests are used to identify the cause of urinary tract infections and determines which antibiotic would be more effective. Endoscopy. It is the visualization, examination of interior of the body cavity. Endoscopic surgery is performed through small incisions with the use of an endoscope and specialized instruments. Endoscopes, again, use a flexible tube with a light and lens designed to examine interior body parts. Laparoscopic procedures. Laparoscopy is visualization, examination of the interior of the abdomen with the use of laparoscopic pass-through a small incision in the abdominal wall. Laparoscope, again, is a specialized instrument used to explore and examine the interior of the abdomen. Also, it's used to obtain specimens to be biopsied or perform surgical procedures. You see here a diagram of a laparoscopic procedure. Centesis, surgical puncture to remove excess fluid or remove fluid for diagnostic purposes. Abdominocentesis removes fluid from the abdominal cavity. Orthocentesis removes synovial fluid to determine the cause of pain or swelling in a joint. Cardiocentesis is puncturing the chamber of heart for diagnosis or therapy. Pericardiocentesis is puncturing the pericardial sac for removal of fluid. Imaging techniques. Visualize and examine the internal body structures. Contrast medium is administered by swallowing an emena or IV to make specific body structures visible. Radiopaque is a substance that does not allow X-rays to pass through. It appears white or light gray. Radiolucent is a substance that allows X-rays to pass through. They appear black or dark gray. Intravenous contrast medium is injected into the vein for visualization of blood flow. A barium is a radiopaque contrast medium used primarily to visualize the GI tract, and it may be administered as a barium swallow or barium enema. Now let's look at radiology. This creates an image of hard tissue, internal structures by exposure of sensitized film to X-ray. Radi means radiation. Ology means study of. A radiologist is a physician who specializes in diagnosing and treating diseases, disorders by use of X-rays and other forms of radiant energy. You also have a subspecialty in radiology called interventional radiology, and it's the use of radiographic imaging to guide a procedure such as a biopsy. Radiographic positioning is placement of the part of the body closest to the X-ray film. Radiographic projections is the path that the X-ray beam follows through the body from entrance to exit. Dental radiology. You have things such as extraoral radiology. The film is placed and exposed outside the mouth. Intraoral radiology. The film is placed within the mouth and exposed by camera position next to the exterior of the cheek. Tomography is the use of X-rays or ultrasound to produce cross-sections of the body. Computed tomography is an X-ray beam that rotates around the patient to produce multiple cross-sectional views. Inflammation Here you see a diagram of a computed tomography, which is also referred to as a CT. Magnetic resonance imaging, also known as an MRI, is the combination of radio waves and magnetic field creating signals that are sent to a computer and converted into images. Magnetic resonance angiography locates problems within blood vessels. Fluoroscopy visualizes body parts in motion, projecting X-ray images on fluorescent screen. Fluoro means glowing. Cineradiography is the recording of fluoroscopy images. Sine or sin is related to movement. Ultrasonography is the recording of echoes of sound waves, pulses above the range of the human ear. Imaging of deep body structures. Sonogram, which is an image created by an ultrasonography. Cardiography is electronic diagnostic procedure to evaluate the structures and motion of the heart. A Doppler echocardiogram measures speed and direction of blood flow within the body. Fetal ultrasound are images used to evaluate the fetal development during pregnancy. Transesophageal echocardiography. Ultrasonic imaging to evaluate heart structures. Performed from inside the esophagus and produces clearer images than in echocardiography. Nuclear medicine is used for diagnostic or treatment purposes. It uses radioactive materials inserted into veins, taken by mouth, or placed inside the body. Nuclear medicine technologist is someone who specializes in preparation and administration of radiopharmaceuticals. Nuclear imaging is the use of radiopharmaceuticals for documenting the structure and function of the organ being examined. Nuclear scan uses nuclear medicine to gather information about the structures and function of organs that cannot be seen on conventional X-rays. A bone scan identifies new areas of bone growth or breakdown. Thyroid scan uses radioactive iodine administered to determine thyroid gland's ability to concentrate certain radioactive isotopes, and images are generated to determine the size, shape, and activity. Single photon emission computed tomography, SPECT, produces a 3D computer reconstructed image showing perfusion through tissue and organs. Positron emission tomography, a PET scan, combines tomography and radionuclide traces to enhance images of selected organs or areas. Pharmacology. This is the study of the nature, uses, and effects of drugs for medical purposes. Pharmac means drug. A pharmacist is a licensed specialist who formulates and dispenses prescribed medications. There are some frequently used drug use administration abbreviations and symbols. Many are derived from Latin terms. Joint Commission released a list of do not use abbreviations designed to reduce medication errors. Prescription and over-the-counter drugs. Prescription, medication that can be only legally dispensed by a pharmacist with the order from a licensed professional. Over-the-counter drugs, also called OTCs, are medication that can be purchased without any prescription. Generic and brand name drugs. Generic usually is named for its chemical structure, not protected by brand name or trademark. A brand name is sold under the name given by the manufacturer and always spelled with a capital letter. Formulary is the list of prescription drugs covered by a specific health care plan. A physician's desk reference is most commonly used drug information guide and is updated annually. Terminology related to pharmacology: addiction. This is compulsive, uncontrollable dependence on drug, alcohol, or other substances. Controlled substances are addictive prescription medicines and illegal drugs. Manufacture, possession, and use are regulated by the government. Drug tolerance. The body becomes accustomed to medication after a length of time, and higher dose is required to achieve the desired effect. Adverse reaction. This is an undesirable reaction accompanying the principal response for which the drug was taken. Compliance is patient's consistency and accuracy in following regimen prescribed by the physician. Contraindication is a condition that makes use of medication or treatment dangerous or ill-advised. Drug interaction. Drugs react with each other in an unexpected or potentially harmful manner. Synergism is interaction of two drugs enhancing the effectiveness of both. Idiosyncratic reaction was its unexpected reaction to drug. Peculiar to the individual. Palliative eases pain or severity, but the paradoxical reaction is the opposite of normally expected results. Placebo is the inactive substance administered for its suggestive effects. Antipyretic prevents or reduces fever. Anti-inflammatory relieves inflammation and pain and does not affect consciousness. Medications for pain management. Analgesics relieves pain without affecting consciousness. Non-narcotic analgesics are available by over-the-counter or prescription for mild to moderate pain relief. Narcotic analgesics are available by prescription only to relieve severe pain. Acetaminophen is an analgesic that relieves pain and fever and does not relieve inflammation. Non-steroidal anti-inflammatory drugs are non-narcotic analgesics for the pain by reducing inflammation and swelling. May be over the counter or by prescription. Ibuprofen or NSAID with brand names of Advil and Motrin and acts as an analgesic and antipyretic. Additional pain control methods, pain relieving creams. These are applied topically. Transcutaneous electronic nerve stimulation, TENS, is a device that delivers a small electrical pulse to nerve endings throughout the skin. Methods of drug administration. Inhalation administration are vapors and gases taken in through the nose or mouth, absorbed into the bloodstream through lungs. Oral administration is medications taken by mouth, absorbed through walls of the stomach and small intestine, and may be liquid, tablet, or capsule. Rectal examination is the insertion of medication into the rectum. It may be a suppository or liquid. Sublingual administration is placement of medication under the tongue. It dissolves slowly and is quickly absorbed directly into the bloodstream. Topical application is liquid or ointment rubbed into the skin at the area being treated. Transdermal medication is administered from patch applied to unbroken skin, absorbed through skin, and transmitted to the bloodstream, producing systemic effect. Parenteral administration is taken into the body or administered by method other than GI tract, most often administered through the use of a hypodermic syringe, a subcutaneous injection, administered into fatty layer just below the skin. Intradermal injection is administered into middle layers of the skin. Intramuscular injection, IM, is administered directly into the muscle tissue. And IV, intravenous injection, is administered directly into the vein. Peripherally inserted catheter, a PICC line, is used for a patient needing IV therapy for more than 7 days. Bolus is a single concentrated dose of a drug, usually injected into the blood vessel over a short period of time. Allopathic medicine is a conventional or Western medicine practices and systems of healthcare. Alternative medicine, practice and systems of healthcare used in place of allopathic approaches. Complementary medicine is practices and systems of healthcare supplementing allopathic approaches. Integrated medicine is healthcare based on allopathic and alternative medicine. Holistic is treatment considering the whole body and its environment, including mind, body, and spirit. Wellness is actively working toward a state of good physical and mental health. That concludes our discussion for word part structure dealing with diagnostic procedures and pharmacology. Thank you.